Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us again. Going to be speaking with Dr. Navneet Majhail this morning. He's Director of Blood and Marrow Transplant Program at the Cleveland Clinic, and he's joining us to talk about an Incyte Ingenuity Award, going to discuss how he is a judge and talk about the award program overall. Welcome to Health Professional Radio, Dr. Majhail.
Thank you, Neil. It's a pleasure to be here.
Give our listeners a bit of your background and talk about your role briefly there at the Cleveland Clinic.
Sure, certainly. So I am the director of the Blood and Marrow Transplant Program, and I'm also the vice chair for the Department of Hematology Oncology here at the Taussig Cancer Institute at the Cleveland Clinic in Cleveland, Ohio. And my clinical expertise is in taking care of adult patients who need a blood and marrow transplant or a hematopoietic stem cell transplant. So again, these are typically patients with life-threatening, typically pretty advanced and aggressive, mostly blood cancers. And the treatment for those patients tends to be bone marrow transplant, and that is what I focus on. My research is in the area of outcomes research, long-term outcomes, survivorship, and the prevention and management of complications that patients with blood and marrow transplant might experience, including graft-versus-host disease.
This graft-versus-host disease, is that one of the most prevalent challenges that someone receiving a transplant would encounter?
So it is one of the more prominent or devastating complications that our patients can get. And to be honest, Neil, it is like the bane of my existence, because we try to cure these patients with really aggressive blood cancers and advanced malignancies, and sometimes you end up curing their underlying cancer and instead end up giving them another disease, which can cause long-term morbidity and quality of life impairments.
How difficult is it to research into GVHD?
So one of the challenges we face with graft-versus-host disease is that we've done bone marrow transplants for almost 4 to 5 decades, and we are still trying to understand how to prevent and manage this complication called graft-versus-host disease. Again, just stepping back a bit here, Neil. So just stepping back a bit here, what we try to do in bone marrow transplant is we basically take someone with an advanced blood cancer. We give them very high doses of chemotherapy and sometimes radiation. And the whole idea is to wipe out their bone marrow completely. I mean, you can think about blood counts going down to essentially zero, which are not compatible with life. Mm-hmm. And at that point, we give them blood stem cells, hematopoietic, healthy stem cells from an immune-matched donor, with the whole idea that those cells can go down to the bone marrow, can help reconstitute hematopoiesis, blood formation, and also give those patients a new immune system. And what happens is we take all these precautions, like these patients have to be on immune rejection medications. We watch them carefully because we want this new immune system to take. And once in a while, what happens is this new immune system, as it's settling down, it goes into an overdrive. And as it goes into an overdrive, it can cause problems with your mouth, your lungs, liver, skin, GI tract, other organs, basically your normal tissues. And that is what is graft-versus-host disease. And now the challenge is those same immune cells which control your leukemia. So those same immune cells are also the ones that cause graft-versus-host disease. And we also always say that the holy grail of our field is to trying to tease out that good immune effect against the cancer from the bad immune effect that happens towards the normal tissues and causes graft-versus-host disease. I will say, it's a very exciting era, because a lot of good research just for the last decade has come out, which helps us better understand who gets graft-versus-host disease, how do we manage it, how do we treat it, but it's still a work in progress.
Now, I do understand, of course, and I did mention that you're an Incyte Ingenuity Award judge. What is the Incyte Ingenuity Award?
Yeah, so the Incyte Ingenuity Award is basically a program that addresses some of the challenges that are faced by both patients with graft-versus-host disease and their caregivers and families, as well as the clinicians who take care of those patients. And Neil, it's a very unique award program. So to give you a sense, one of the first criteria for disqualification for this award is that they don't take research that focuses on a specific therapeutic agent or translational research or clinical research that is interventional in nature. So at the end of the day, that award program is designed to focus on practical issues that might be faced by graft-versus-host disease patients or the people who take care of them. So and the whole idea is to help stimulate innovative and out-of-the-box thinking to address those issues. So if you think about it, the kind of projects we are interested in looking at, they would typically not be funded by your traditional funding mechanism. So where the focus is more on mechanistic studies, the focus is more on therapeutic interventions. To give you an example, the project that was funded last year in 2020 was a patient-centered multi-component mobile app, which focused on improving the quality of life and care of graft-versus-host disease patients. So basically, that program, that app was designed to identify symptoms, help patients with self-management strategies, help them garner and build up resources and social support systems so that those patients could cope with the issues that come with graft-versus-host disease and also stimulate healthy behaviors, which can hopefully help them live longer and address all that's going on with them.
Can anyone be an entrant, and how can one become a judge?
Yeah, so in terms of the eligibility for application, and so it's pretty broad, and I would say it's broader than most other traditional funding mechanisms because, obviously your typical patient-oriented researchers can apply. You can have people who work in the policy space can apply. But it's also open to nonprofit organizations. And in fact, last year for this award, we had a couple of patient advocacy organizations apply for this grant or this award as well. So again, I think it's unique in that perspective. And again, you can also be individuals or other companies who are interested in this space, but then you must partner with a nonprofit organization or a healthcare facility like an academic research center to put in an application. Now, with respect to the judging piece, that is also very unique and different about this award. Again, we have a total of 5 judges this coming year, and we have a combination of clinicians and researchers like myself. We have other clinicians. We have a pharmacist who is serving as a judge, and we also have patient advocates. In fact, one of the patient advocate judges is a gentleman whose family is affected by graft-versus-host disease. So he really knows what patients go through and what really is impactful for patients. And I can tell you it was a very interesting conversation as we looked at some of the projects that came in last year, because I'd be like, oh, wow, this is such an innovative, novel idea. This is great. And he would say, well, help me understand how is it going to impact a patient with graft-versus-host disease? And as you think about that, oh my God, yes, he's right. Even though this is cutting edge, but I don't see it really helping a patient physically.
So basically, you have to pinpoint the type of idea that's presented to make sure that it will benefit that specific community.
Exactly. So it is, the whole idea is to come up with these novel, innovative, patient-focused interventions, patient-focused interventions that can hopefully be applied and can improve patient experience, quality of life of either the patients or people who are around them as they try to deal with graft-versus-host disease.
Where can people learn more about the Ingenuity Award and apply?
So they have a website. It's an online application portal. So it's at www.incyteingenuityawards.com. So if they go to that website, they have laid out what the application criteria are, what kind of projects they're looking for, and also what are some of the reasons people may not be eligible to apply, or what are the kind of projects that may not be optimal for this award opportunity.
And just to let listeners know, the program has expanded this year, I do believe, financially.
Yes, it has, because last year it gave out one award of $100,000. And one of the things, as we circled back and looked at the type of applications we had received, we were really impressed by the diversity of different applications, the projects that people wanted to do, and also the interest in the award. It was pretty phenomenal to see there were so many good ideas. And at the end of the day, at some level, we felt bad that we could not fund many of them. And again, given the fact that we saw the scope of what people want to look at is very different, so that is why this coming year or this year we'll have two awards. One will be a larger grant, which will be $100,000, and then there'll be a smaller award, which is $35,000.
Great. Well, I appreciate you joining us here on the program. It's been interesting talking with you, and I thank you very much.
No, it's been a pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Navneet Majhail. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.